A very good morning, everyone. I am Dr. Pankaj Verma from Department of Oral Pathology and Microbiology, Institute of Dental Studies and Technologies, Kadrabad, UP. The topic of my presentation is saliva as a diagnostic tool. Now, I am going to share my presentation. Saliva is a clear, slightly acidic complex biological fluid which is composed of secretions from major salivary glands, which include parotid, submandibular, sublingual glands, and minor salivary glands like buccal, lingual, and palatal glands. In general, 1 to 1.5 liters of serous and mucinous saliva is secreted daily by these glands. The advantages of saliva as a diagnostic tool are it can be used in surveillance of disease, diagnosis of disease, prognosis and research purposes, and it is easier to handle. It doesn't clot. It requires light manipulation also. It contains a variety of hormones, antibodies, antimicrobial constituents, and growth factors. Now, the collection methods of saliva, there are two methods. One is stimulated method. In this, saliva is commonly collected by inducing masticatory actions on chewing gum to increase salivary flow rate. This method will affect the quantity and pH of saliva. And generally, this method is used in patients who have difficulty producing enough saliva. Next is unstimulated method. In this, the saliva is collected without exogenous facilitation, and its flow rate is mostly affected by the degree of hydration. There are three most common approaches. First is draining, spitting, and suctioning. Saliva as a diagnostic tool has various applications in various fields like medicine, dentistry, and pharmacotherapy. Now come to autoimmune disorders. Jordan's syndrome is a chronic autoimmune disorder which is characterized by salivary and lacrimal gland dysfunction, serological abnormalities, and multiple organ system changes. Thus, in saliva, the IgG isotype to nuclear autoantigens are found. The studies suggested that salivary IL-2 and IL-6 concentrations are significantly elevated in Jordan syndrome patients. Now, in cardiovascular system, the cardiovascular disease is a major cause of death worldwide. The determination of serum amylase and salivary amylase activity has been made before and after cardiovascular surgeries. In ruptured aortic aneurysm, salivary alpha amylase is increased. It has an application in endocrinology also. Currently, the following steroids can be assessed in saliva: the testosterone, the androsterone, cortisol, estradiol. These assays can be useful in evaluation of mood and cognitive emotional behavior to predict the sexual activity in adolescent male and to study the child health and development, and in consideration of premenstrual depression and also screening for the Cushing syndrome. Now come to the infectious diseases. In virus diseases, in HIV virus, there is development of autoantibodies directed towards specific viral epitopes. And also measuring of these proteins has facilitated the use of testing for HIV infection. The PCR is used to measure many viruses: the herpes virus, the cytomegalovirus, Epstein-Barr virus, hepatitis C virus, and also COVID-19 virus. In bacterial infections, saliva is used for the diagnosis of H. pylori infection, which is a critical pathogen which is associated with peptic ulcers. H. pylori antibodies in saliva may be valuable for predicting risk of gastric adenocarcinoma. Saliva also used for detection of dental caries, gingivitis, and periodontal diseases. Recently, some studies have shown some kits are used to collect and analyze the salivary levels of P. gingivalis. In nephrology, the salivary creatinine concentrations show high sensitivity and specificity for determining the renal diseases. In oncology, various molecular markers for the diagnosis of OSCC can be identified in three levels: changes in cellular DNA, altered mRNA transcripts, altered protein levels. MMP9. Camerin is used for early detection of oral squamous cell carcinoma. Changes in cellular DNA also can be analyzed. The mitochondrial DNA mutations, P53 mutations, cyclin D1 gene amplifications, microsatellite alterations of DNA were also observed in saliva of patients of small cell lung cancer. The presence of HPV and EBV gene sequences have been identified as possible DNA molecular markers detected in saliva, which can predict the tumor progression. The altered mRNA transcript can also be analyzed in saliva, which are interleukin 8, interleukin 1b, DUSP1, H3F3A, OS1, S100P, and SET. Altered protein markers can also be analyzed in saliva. The IL-8 was detected in higher concentration in saliva. Salivary kallikrein shows higher level in malignant tumor as compared to benign diagnosed patient. It can also be used for drug monitoring. Cotinine, cocaine, opioids, barbiturates, diazepines, amphetamines, and ethanols can be analyzed. It can be used in psychiatry also. The salivary levels of 3-methoxy-4-hydroxyphenyl glycol, and also it has been used to measure post-traumatic stress disorder associated with wartime. Now, there are various barriers also for the development of the salivary diagnostics. The first barrier is it needs to design and develop microsensors which are capable of accurate measurements in small volumes. Secondly, the cost of development is expensive and may produce significant barrier. Third, the medical insurance companies will have to be convinced that saliva-based diagnostics are highly accurate and as well as cost effective. Now come to the conclusion. The saliva offers an alternative to serum as biological fluid that can be analyzed. Monitoring of immune responses to viral infection, including hepatitis, HIV, may prove valuable in the identification of infected individual, non-symptomatic carriers, and immune individuals. Saliva can also be used in monitoring of therapeutic drug levels. Due to its many potential advantages, salivary diagnostic provides an attractive alternative to more invasive, time-consuming, complicated, and expensive diagnostic approaches. Hence, salivary diagnostic tests can replace the serum diagnostic procedures in near future. Thank you so much.